So to get started, it's highly pathogenic avian influenza. Some of the takeaways that I hope that our audience can come up with are, the worker experience throughout this outbreak, our state of preparedness nationally, as well as just a general firm, grounded understanding of what we're looking at here. The audience is made up of a very blended representation of sectors: industrial, commercial, clinical, academic, community representation here. And one of the most important things that you can take away with here is knowledge to share with colleagues, with coworkers, with neighbors, and with patients. Because once we all take our hats off, we're all people with a problem with our food chain right now. So with all that said, I'll introduce our first speaker. It's Dr. Meghan Frost Davis. Dr. Davis is Associate Professor and the Director of our One Health Laboratory at Johns Hopkins in the Department of Environmental Health and Engineering. She's molecular epidemiology and environmental microbiology. Meghan studies the interface of bacteria and hosts to reduce microbe-mediated diseases in humans and animals, amongst many other things. And I can't wait to hear what you have to say, Meghan. You go ahead.
Great. Thank you so much, Chris. I also happen to direct the Johns Hopkins Total Worker Health Center in Mental Health, which is one of our sponsoring groups today. And a lot of the focus that we have with this particular outbreak of highly pathogenic avian influenza in dairy cows is on worker protection. So I think I'm going to talk a little bit about this and then turn it over to Dr. Chris Heaney to talk more. And then we'll go into some larger discussions with Dr. Greg Gray, one of our friends, colleagues, fellow researchers in this space, who's really been a thought leader in many areas and also happened to identify additional cases that were missed by the surveillance structures in Texas, which is where this story begins. So let me just set the stage. The Texas Panhandle, it's March, and there are cows that are sick. And these cows are off feed. They're, having really a lot of changes in their milk production. The milk itself looks awful. They've also got some gastrointestinal symptoms. And it was widespread enough that, there was some suspicion for infectious diseases, but all the usual suspects turned up negative. And so when the samples were tested against a much larger battery of tests, to everyone's surprise, given that we don't typically see a lot of influenza A in dairy cows. You might see some influenza D, but not a lot of A. It was H5N1, a strain that has been circulating globally, causing mass mortality in bird populations and including marine mammal populations since late 2021. We've had, challenges in the US since 2022. And it had caused outbreaks in many different poultry facilities. Now, this is something that happens. I'm a former dairy veterinarian, so still a veterinarian, just no longer in dairy practice. And with large-scale poultry operations, we do see these pop up. And most of the groups that are impacted are those who are involved in the activities that we use to contain the virus in the poultry industry, which is a process called stamping out. So we basically cull the animals as a way to prevent further spread within the animal population. It causes really high mortality. Some of these animals would have died anyway. But the act of going into these spaces, which, you've got a lot of birds, they're flapping their wings, there's stuff in the air. Even if you're wearing a mask, sometimes if the fit isn't very good, you can get entry of the virus. And so these are workers who have, gotten sick in the past. And we did have a case in Colorado in 2022 related to those stamping out activities. But now we see it in dairy cows. And this is a very different environment. And I was trained in California in Tulare, which is where we have our current biggest outbreak in the US. In the dairy cows, and practiced in Pennsylvania, a very different model. But you go into these milking parlors and the udder is right here, it's at face height. So it makes sense that splash from handling the milking equipment, having some of the milk, which is the most contagious thing that we see coming out of the cows is the milk, can lead to conjunctivitis and some of these respiratory symptoms. It's also possible that there are other ways in which people are getting exposed. They might touch a contaminated surface and then rub their eyes. I know I'm probably just as guilty as anyone rubbing my eyes while on a farm, just because there's so much going on, right? There are things in the air, and you just kind of need to clear things off every now and then. So how these workers are getting exposed makes sense. We do recognize that personal protective equipment, or PPE, that we might want to use, and what's being recommended is a whole suite of PPE for these workers, wearing masks, wearing goggles or face shields, wearing Tyvek or fluid-resistant coveralls, covering up other surfaces where you can, obviously putting on gloves is what's recommended. When you're working in these environments, this PPE can degenerate pretty quickly. Sometimes they're very hot, moist environments with lots of organic material, spraying down with water and working pretty rapidly with a lot of the cows that are coming through. So it makes sense that there would be some challenges with this. We do see that some of the workers who have gotten sick aren't wearing as much PPE, but there are some who have been wearing it who've nonetheless gotten sick. And I think we're still investigating what their routes of exposure might be. To date, we have 30 confirmed cases in the United States. The CDC website hasn't quite caught up with 2 more confirmations lately. There are 15 confirmed in California, which is where we have most of the current activity happening with the dairy-related outbreak of H5N1. So these 15 cases across 13 different farms. And there have been 137 dairy herds affected. We also have activity happening in other states as well. So in the state of Washington, we have a poultry facility. This is actually not associated with the dairy-related strain. It's still an H5N1. It's still part of kind of this larger clade that's circulating, but it is a slightly different genetic code that is probably then linked to migratory birds, although that hasn't been fully confirmed yet. But that's where we have some additional activity happening. And also in Utah, there was another poultry facility recently impacted, this time with the strain associated with dairy cows. And I just saw today that they've started to do increased surveillance in Utah, a little bit similar to what's been happening in California, where in order to understand which farms are positive and therefore which workers could be at risk, if you don't have symptomatic cows, the way to do this is to test the milk in the big milk tank on the farm where all the cows are milked into. It's called a bulk milk tank. So that's just the terminology that's used, but it's basically a pooled sample across pretty much every cow in milk whose milk isn't being diverted. So cows in sick pens are usually milked into a separate bulk milk tank, but the ones that are going into commercial use go into the main one. And cows, even without symptoms, can be shedding quite a bit in the milk. And so that's a good surveillance strategy to understand which farms are positive and therefore to understand which workers could be at risk. And so I think to talk a little bit more about the workers and the worker risk and some of the aspects of the communities that really are very important to engage as part of these activities and really as participatory ways as possible is Dr. Chris Heaney. So let me turn it back to Chris to introduce Chris.
Chris Spicer here, introducing Chris Heaney. Thank you very much, Megan. That was wonderful. Dr. Chris Heaney his research focuses on environmentally mediated impacts on health and well-being, specifically community land use, waste disposal, food production practices, and integrates academic disciplines of microbiology, molecular biology, immunology, epidemiology, and a lot of other ologies with community-based participatory research. Chris directs our laboratory for salivary biomarkers of infectious diseases, our environmental health, microbiology, and immunology laboratories, as well as our community science and innovation for environmental justice initiative. And has been doing a lot of marvelous work on the community front and the community line with a lot of this. So, Chris, I'll turn it over to you.
Thanks so much, Chris Spicer. It's a real pleasure to be here. Thank you, Dr. Davis, for that overview and setting of the stage. I think the thing that we here today, all attendees, and I see many familiar names and people on Zoom, which is great. But I think we need to recognize is that, information, knowledge is power and allows us to be taking stances that could be protective of health, our health, as we're trying to educate and communicate out, we're trying to have this information empower and help others take a stance that can protect them. But I think the thing that we have to consider in the worker health, the worker hazard exposure, is that the system that we have in place is not exactly supportive in many instances of the workers' ability to gain access to information that could potentially help protect them from hazards. And so I think even as I'm learning from my esteemed colleague, Dr. Meghan Davis, and the fact that I am in a position of an institution with access to scientific research, resources, and I can walk down the hall and I can be in a conversation with Dr. Meghan Davis, and she can say something that we just learned today, that there is example of human-to-human transmission without known animal or livestock exposure, right? That's one of the challenges in a lot of the livestock production worker contexts in the communities where livestock production is intensified. It is a challenge with what is known, what do we know, and often, as was the case as we learned with great disease, great morbidity, great mortality burden, was borne by the frontline workers in our food animal production system, everything from production workers to processing workers. And so I think something that we really need to think about is how do we help supply information and put it into the hands of both the workers in the livestock production industry, but also create the structural supports where that knowledge can create the more protective conditions for workers. And I think one of the things that we focused on, it's a very technical aspect of it, but we have done over a decade of work in this space, is access to information about through testing, through confidential testing where results can be communicated in a way that are assuring the privacy and the confidentiality and to protect the workers as they begin to understand the implications of exposure to a zoonotic, to a pathogenic exposure. Pathogens could be epidemic in nature. They could be potentially pandemic, or they could be within the context of the COVID-19 pandemic, right? And so I think what we heard Dr. Davis speak about what are the tools in the toolkit for protection, there's things like PPE, but are they practical? And to what extent could a worker increase their utilization of PPE absent other engineered or structural changes at the facilities where they work? But they need to have the information. I think around H5N1, what we're dealing with is, I think a lot of workers feel like they're on their own. They don't really know whether there is a risk or not. I think with where we are, fortunately, as far as what's been reported about human cases of H5N1, is that their signs and symptoms are relatively mild. But if that were to change, that picture were to drastically change, I think the utility of conveying that knowledge through knowledge of exposure, knowledge of where is there evidence of transmission, dissemination, I think it will become much more critical. I'm uncertain with the prior examples I've worked on, which have been improving the understanding through confidential and trust building testing around antimicrobial resistant bacteria, which can be amplified by the use of antimicrobials, not only in human clinical medicine, but also in food animal production, right? In that space, I think the information, seeing how it can be applied and try to help workers make protective decisions for themselves, their families, coworkers, and in communities. And then next with some just studying routine circulation of influenza viruses. I think where we are here now I think our track record is something to be desired. And I think that's perhaps a nice handoff to our third panelist, Dr. Greg Gray. I'd be happy to loop back and hear audience questions about some of our other experiences within communities of livestock workers and then general community residents in areas where livestock production is intensive.
Thank you very much, Chris. I look forward to the questions that we can answer and some of these answers. Dr. Gregory Gray, very pleased to be able to present Dr. Gray. He's a professor in infectious disease epidemiology in the departments of internal medicine and infectious diseases division, microbiology and immunology, and global health at the University of Texas Medical Branch in Galveston, Texas. And Dr. Gray has been very engaged in surveillance research around HPAI. And I'm pleased to hand it over to Dr. Gray. Go ahead.
Thanks, Chris, and thanks, Meghan and Chris Heaney, for inviting me to join you guys. And we've, on the record, we've collaborated together in a number of venues. I've been asked to sort of talk a bit about our investigation of this, and that's what I'm going to try to do. I want to start by saying that my screen will come up. Let's start by saying that we want to preface this with respect to sort of a philosophy of how we do these kind of and why we do these things and how. Maybe I just need to clean. My screen is locked up, so let me stop sharing here and see if I can shut that down. Oh, great. Well, first of all, we kind of got in this to attempt to predict and then mitigate whatever emerging threats might be. And those threats that we're most concerned about are the threats that cause massive illness in humans, particularly the illnesses that we would consider pandemic in nature. And when you think about pandemics, can you see my screen now?
Not yet.
Okay, let's try again. When you think about pandemics, we think about all the previous events that have caused massive mortality and morbidity in humans. And they include, of course, things like cholera and Yersinia pestis or plague. But they also include, in recent years, these pesky respiratory viruses. And I'm having trouble getting this fully grown up, but basically it's these pesky respiratory viruses that seem to have given us the most angst in recent years, as they move so quickly and they are so hard to stop once they become highly transmissible. When we think about the nature of many of the zoonotic pathogens, including the respiratory viruses, it's important to note that our immune situation is such that about 70% of the time, these emerging viruses come from animals, and they require constant interrogation of our immune systems and frequent repetitive ways with probably large numbers of varying viruses before a virus will take hold. And that's because our immune systems are wonderfully made and we have so many barriers for this. So it takes many years and likely large populations of animals harboring many different viral variants statistically before we see an incursion. And even more years, repetitive challenges with similar viruses before we see limited human-to-human transmission And finally, one would argue evolutionarily that it would take even more years before the virus would become highly efficient. So if we have time to study and surveil for viruses that human-animal interface, that's a pretty good strategy for finding viruses that spill over from animals to humans. Now, if you follow the emerging pathogen stories in the news, or at least in the movies, one would think this happens more immediately. And certainly, I think the truth is, as illustrated by this nice review article by colleague Sarah Sawyer, that there are many barriers for the viruses from animals to move to humans before they can become efficient and highly transmissible. So time is on our side. And that's why when you look at the evolutionary clock for novel viruses, it takes a long time. With respect to the recent pandemic, SARS-CoV-2 probably departed from its animal ancestors some 40 to 70 years ago. So if you wanted to look for the next pandemic virus, spillover events, there are a lot of viruses out there and a lot of animals. How would you do so? So we did a review paper, if you will, to look at respiratory viruses and their epidemics and the animal reservoirs. And I'll just sum it up quickly that we found a lot of morbidity and mortality associated with emerging viruses. And we could summarize these in about 6 viral families. So it greatly reduces the number of viruses we'd need to surveil for and wanting to preempt a pandemic. And where would you look for these spillover events to occur? Well, you would want to look for people exposed repetitively for long periods of time, such as occupational animal workers, have large populations of animals. It's not somebody that periodically visits a pet shop or a zoo. We're talking about people that work, 7, 8 hours a day with a lot of animals. And one of the places to think about these exposures are industrialized farming. And industrialized farming is growing in scale all over the world because it's more economical and it's more biosecure to have large facilities that are well controlled. But even so, viruses seem to have a way to get into these facilities. And when they do, the viruses can replicate, make copies of itself through the many animals almost unchecked. And if the viruses don't cause severe illness in the animals, the viruses can be sustained with many variants. And we know this from studies that where the farm permits viruses to exist and doesn't eliminate the animals, the variants increase in size with the concentration of the animals. So in partnership with veterinarians like Dr. Davis, we said, well, how would you look for these 6 viral families, new viruses? And we have developed algorithms to do so. These algorithms focus on known viruses with targeted molecular assays and also discovering new viruses with conventional assays and sequencing. And we've been teaching these techniques to laboratorians in various parts of the world under US government contracts for a number of years as a way to look for pre-pandemic strains and attempt to mitigate them. Now we do this in 2 ways. Ideally, we do it in an animal exposure setting, such as a farm or a live animal market or somewhere else where there's a lot of concentration to large numbers of animals. If we can't do that, and as often the case in the United States, the industrialized farming doesn't want us to study their farms, then a second best approach is to look at pneumonia, causes of pneumonia or hospitalization with pneumonia in areas that are known to previously harbor emerging viruses. But here's an illustration of the type of study that we've done in China with our partners there, looking in a One Health way at humans, animals, and the environment for novel virus transmission. And this we could only have done with our all the manpower that our colleagues in China provided. But basically, we found that there was almost no way, if you were an animal worker, to be not be infected with an emergent virus if you had this kind of intensive exposure. So the occupational risk things that Chris Heaney worries about are very real for these workers. Whatever emergence in these farms is likely to infect these workers. And it's in their interest that we try to find ways to protect them, as well as spilling back of the virus from humans to the animals to protect the animals. Now, where we can't do the intensive animal exposure studies, we do pneumonia etiology studies. And I'll just say that we've done this in a lot of places in the world, and it works. We've discovered a number of viruses that shouldn't be where they are. We found human viruses in animals, animal viruses in humans, and animal viruses jumping to other animals that had not seen before using these techniques. And so with this as a preface, know that we had some funding to do this before the H5N1 epizootic occurred. And the focus in the funding was not on influenza A, but on coronaviruses, because SARS-CoV-2 had spilled over to animals, and the US government was concerned that the virus might change in animal populations and spill back, cause severe disease in humans. So we needed to get a handle on the virus transmission and domestic and wildlife as a way to protect humans as well as livestock. So with this study in mind, sponsored by the USDA, we were commissioned in a 5-year way to prospectively enroll 16 farms in the United States and Mexico with One Health studies, where we would visit the farm a total of 4 times over 12 months, would collect samples from ill animals, healthy workers, and the environment, and look for particularly coronaviruses, but also had permission to look for other viruses such as avian flu. With that in mind, what happened, and Meghan alluded to this, Dr. Davis alluded to this, there's been a lot of strange stuff going on with highly pathogenic avian flu. We've seen just a tremendous number of different variants, and particularly this clade 2.3.4.4b has wreaked havoc on wildlife. We've seen it all across the United States, and we've also seen, as Meghan alluded, movement of this to mammals that don't often get influenza, particularly carnivores that eat the wild birds that may have succumbed to the virus. And so in March, as Dr. Davis mentioned, we saw all these changes in the dairy cattle, and we're fortunate to note these, but it's important to note that we only noted these because we weren't really looking for flu in the dairy cattle. We only noted these when we tried to figure out why the milk production had gone awry and why the cows are not doing well. So we found at this time the mortality in the cows 1 to 2%, and most of the infections were mild and the cows fully recovered. But recently we're seeing a different picture in California, that the more cows are dying, some say as much as 20%, and maybe there's basically more severe disease. Well, since February, when these cases were first seen in Texas, we've now seen in excess of 339 dairy farms in the United States affected in 14 states. And as Dr. Davis alluded, there are now in excess of 30 human infections, mostly from dairy cattle exposures, associated with its H5N1 viral variants. When we've attempted to look at this in a way that we normally would in an epidemic, there have been a lot of pushback from the industrial farming community. And we've learned, particularly from our veterinary livestock colleagues, that there's little trust between the farms and government, and no real effective surveillance for novel pathogen emergence on these farms. And while we theoretically have time to detect and respond, we really have a whack-a-mole mentality. We wait for something to raise its head and we try to knock it down. And this is but another example of that with our current public health system. It's just not working as well as we'd like. Some of the problems are we really don't have one discipline that's trained to, study such zoonotic emergence. We don't have one agency or organization. In fact, if you look at food security, there are 14 or more, 16 federal agencies with some responsibility, and they don't always work together so well. And so there's sometimes some blockage that's due to these conflicts, apart from the pushback from the farms. And while we have this, each of the federal agencies have proponents for One Health and give sanction to doing One Health activities, it's not always easy to do so because of the current situation, and we really need to find a better way forward. So I'm going to pitch some ideas on how we might move forward in a better way in the future. But on to our work. Because we had these previous relationships with some dairy farms, particularly in investigating another virus called Influenza D, we were invited to communicate with a farm that was having an incursion of H5N1 early on. And we sent them specimens and asked them to collect nasal swabs and rectal swabs from their sick cows, and basically found the virus. And we found a high prevalence, 29% of 24 nasal swabs from the cows to have molecular evidence of the virus. We also ruled out concomitant infections with other pathogens using the system I previously described. This was published in the journal Emerging Infectious Diseases. Then soon thereafter, we were invited to do our on-farm investigations in 2 of these farms. So it's looking at the workers, looking at their animals, both sick and healthy, and looking at the environment. And in this study, we found a very high prevalence of molecular evidence of the virus in milk. 64% of sick cows' milk specimens were positive. We found some other unusual things, including SARS-CoV-2 in one of the sick cows. And most interesting, we found some neutralizing antibody among the farm workers in one farm that came forward and wanted to be tested. And so 2 of those from one farm were positive with neutralizing antibodies, suggesting that they had had infection that was recorded by their immune system during their occupational exposures. We also found the virus in one of the birds that had fallen inside the farms as dead. So since that time, we've been enrolling. I think we have now a total of 12 farms that we've worked on in various different states, and also in Mexico. We have some 1,000 specimens. Often we're testing hypotheses that the veterinarians want us to test to try to see how we can slow this viral transmission from farm to farm down. And we're just beginning to also explore novel virus discovery in some of the sick cows. And here are some early results showing that we're finding some viruses that have never been seen before in sick cows' noses, and not sure exactly what that means, except to say that there are viruses to be discovered if one were able to partner with the bovine veterinarians and willing farms to do so, and hence we might be able to stop severe illness in both the animals and spillover illness should a zoonotic pathogen emerge. The other things that perhaps we should mention is there have been 2 big challenge studies, one in the United States, in particular that's interesting at Kansas State in partnership with a German institute that clearly documented the massive drop-off in milk production in lactating cattle, but they also found evidence for possible transmission in non-lactating cattle, which causes me to be concerned about beef cattle and calves and others cattle and ungulates that might be exposed to these viruses. The other thing we've learned from our partners is that there are sentinel events that now the dairy farms recognize, and in some ways they say we don't need to have the testing because we know we got the virus because our cats have died with strange neurologic manifestations, and we've seen the dead birds that others have reported. Therefore, we're going to try to stay under the radar and not report this to the veterinary diagnostic labs. I don't know if you can see this video, but this cat was probably healthy 24 hours ago, and now it really doesn't move with very much to show a reaction to the people around it. So there's very severe, very rapid neurologic manifestations with on necropsy, very clear encephalitic or brain infection. So our government has now, after some criticism, done quite a bit to intervene. And the Secretary of Agriculture, Vilsack, says that we will soon be have viruses in a vaccine format that could be administered to cattle, and at least 24 companies. In Finland, they're already vaccinating cattle workers against this virus. And we're doing a whole bunch of other things, such as the Dr. Davis mentioned, testing bulk milk and cattle that are moving, cattle that are being brought to processing, et cetera, and a lot of compensation going around. So it's pretty clear that we'll have some interventions that will at least slow down the transmission. But I think there are a lot of questions out there. And I wonder if we'll soon see vaccines offered widely to the cattle and to the cattle workers. One of the most interesting things that's occurred is the value of wastewater sampling and looking for highly pathogenic avian flu, both in Texas and at a national level, in reports like this, where there was very good correlation in time-wise and geographically with the illnesses that we're seeing in the dairy cattle and the wastewater sampling. And so this seems to be a way that we could use as a surrogate for direct sampling on the farms. And I'll just say that there are many questions out there. You know, how did it get into the farms if it came by wild birds? Are we going to see every migrating season incursions and beef and dairy cattle? How is it moving between the farms, within the farms? Are beef cattle infected? My understanding is they're not being tested. What about other ungulates and camelids? We understand that they're susceptible anecdotally. And can we develop better serologic assessments of both livestock and livestock workers? If you read the report today that's released by the CDC, it's taken them many weeks to evaluate the sera of just a handful of people. You know, how can we do this on a larger scale such that we would know the periodicity necessary to give, for instance, seasonal vaccines to either the livestock or to the livestock workers? And so the final thing I want to say is that, you know, there's a lot of pushback from the industry because the government has not always been the industry's friends. So we need to find common ground with the industry, find ways to work with the industries, you know, on mutual problems. And it's in their interest to reduce morbidity due to infectious diseases. It's just we have to do so in a way that protects their businesses. So we had a meeting here in Galveston in April with leaders in the industry looking at food security as the theme. And I'll just say that there was a lot of enthusiasm from scientists, from academia, from the industry about working together on these really complicated problems like emerging infectious diseases. And so there's hope we can find new ways to connect with the industry that would be supportive to them. One model that I advocate for is to establish centers of excellence in One Health research and training, much like the centers we have for influenza and emerging infectious diseases. And these centers, if we could start them up, you know, we could have very close collaborations with industrialized farming in a way that would help solve their problems, and do so in a way that they've not had the support in the past to solve those problems. So with that, I'll close off and see if we have some discussion. And know that the work you've just seen has been the product of many people, including multiple veterinary partners shown here.
Dr. Gray, thank you very much for that. To our audience, I'd like to invite you to raise your hand if you go to the bottom of your screen to reactions. Press raise hand if you would like to ask a question, share your experience, share your insights, perspectives around this from what you've heard with our speakers. And I've got a few questions myself, but I'll yield until the audience takes their turn here. And also, unmuting is a little daunting. Feel free to use the chat, and I'll be happy to read out your questions from the chat.
Hello, can you guys hear me? Oh, perfect. I tried to do the raise hand thing. It wasn't clicking for whatever reason. But this was great. Thank you guys so much for coming in, presenting this and updating us on what's going on. I was just on some workshops yesterday and the day before with the National Academies, and they had a very passionate discussion yesterday on the role of vaccines and its impact on the industry and kind of like where H5N1 is going. So I would love to hear what your opinions are in terms of what the role of vaccine. And I will say, because I do have to leave exactly at 5, I want to know more about your opinions on this agency, this gap. Yes, there are many groups working on this, and it does feel like a centralized approach would be beneficial not only for this disease, but for future diseases. And it doesn't seem like H5N1 is going anywhere. We've seen it now in dairy cattle, beef potentially. We've seen it in swine industry. The poultry industry has been dealing with this for, since the dawn of time. So it's not going anywhere. Is vaccines our one and done solution? What can be done more to surveillance and surveil this issue and for like the future of this issue and others that are similar to it? And then lastly, I will say, Dr. Gray, you mentioned some of your work and it resonated with me with the PREDICT project. And so my question, I guess, there is, did they kind of miss an area that we could have been looking at in terms of workers in agriculture when it comes to spillover events? Should we maybe revamp something similar to that program and shift the focus to agriculture workers when it comes to spillover events? Thank you.
Great. Maybe, Dr. Gray, if you'd like to get started, because I know probably talking a little bit about deep VZN and some of the other strategies would be super,
Yeah.
and then we can segue into vaccines.
Okay, let me go
those
ahead.
aren't going anywhere.
Yeah, I don't know. I think it's clear we're going to see vaccines. Secretary Vilsack says more than a dozen companies are producing them. We know that we have off-the-shelf vaccines that are being studied for both humans and birds. So it's no stretch to see we'd use these in at least dairy cattle, maybe in beef cattle, if the cost can be low. I don't know what DAP is. I'm sorry. The predictant 1 and 2 and the follow-on Deep VZN had a lot of focus on wildlife, and I'm not a great enthusiast of Predict 1 and Predict 2, and I tried to steer Deep VZN towards large animal farming, and the program was canceled basically. So we just don't have a lot of surveillance. I mean, the CDC will say we have some passive surveillance with agriculture, but we could do so much better. And in fact, in some of our international partners in developing countries are doing much better. That sort of surveillance in the milieu of these avian flus, they found effective networks to do surveillance, although their issues are a paucity of funding. So, I've been advocating, let's find a way to work with the industry that won't hurt the industry, and for which they will be champions, and yet to meet the public health needs.
Yeah, I think that's great. And I'm just going to break down the vaccine, because when we say vaccines, we might mean actually a bunch of different things. There is vaccine for seasonal flu for people, and my appointment's scheduled for next week. Hopefully everyone else is getting their public health messaging. I know Hopkins likes us to have it all done by the beginning of November. And the reason for this is that even if we can't fully predict what all the strains that circulate might be, if we can kind of take some off the edges, that as a population and as individuals, we're likely to have less severe disease. Now, seasonal flu vaccination in workers is something the CDC is strongly pushing for. They've even put money into groups like the National Center for Farm Worker Health and some of their additional colleagues and collaborators in order to really try to get the word out to workers to try to have uptake on the regular seasonal flu. And the reason that there is this recommendation is not that we think the seasonal flu vaccine is going to protect against this particular strain, but instead that what we worry about from a spillover and pandemic prevention perspective, so this is from a public health and health security perspective, is that if you have someone who's infected with seasonal flu who is infected at the same time with a strain of avian influenza, that there might be a little hanky-panky between these viruses, and there could be some viral reassortment. And while the chances of that necessarily becoming the next pandemic are, in each case may be small, the more times it happens, kind of the bigger the risk becomes. And so that's the reasoning behind the seasonal flu recommendation. There are more targeted vaccines that have been, there was a candidate vaccine pretty early in this process. There was some good cross-reactivity with what the CDC already had been working on. And so there are some, vials ready to go, and there are trials in effect on the human side for something more specific. And whether that would end up being recommended by CDC in this workforce is a question. I think I'll probably turn it to Chris Heaney to talk about the engagement strategies and the trust building there, because that's another piece of this. Telling a farm worker, oh, we have an experimental vaccine, what do you say, is a little bit different from, hey, we have the vaccine that we give everybody all the time, every year, even though we update it every year. It's kind of based on the same existing technology, and there's not so many changes that we have huge concerns. The animal vaccination landscape is very complicated. From the perspective of the various sectors, you have broiler chickens that only have an 8-week grow out, and handling them is stressful. And so the industry, may or may not be super interested in doing that, just because it might take more effort to vaccinate the animals than is worth it, given just that very short period of time that you're spending raising them. I think the layer industry is quite interested, right? These are birds that stick around a lot longer. This is how you get your eggs. And so these birds last much longer, and they've been really heavily impacted by high pathogenic avian influenza, especially, and including the dairy strain, but especially kind of this, new clade that's been circulating that we've been talking about. You've got turkeys that also, take a little bit longer to grow out, may be worthwhile. And then you've got swine, where we don't currently see this particular strain, but we know they're susceptible, and we feel we need to do more surveillance in them. We've got the dairy cows that stick around on the farm for a long time, and therefore this could be really beneficial. We've got beef, who may have some impacts in terms of regulatory and export markets. So I think they're on the fence as to whether or not they might take this up. And then you've got these smaller, species, which, I don't think we're developing anything specifically for like goats, but we know they're susceptible. The biggest wrinkle in all this are the trade agreements. And so there's something called DVA, where you really want to distinguish your infected from your vaccinated animals, and whether tests can do that determines whether or not you might have blocks on your export markets. And so that can be a really big deal for certainly, some poultry and egg and some dairy. So what we referred to in terms of the National Academies workshop the past 2 days, in which both Dr. Gray and I participated, that was a huge topic, like economically. So I think it's a very interesting market. There are 2 field vaccines being trialed right now for animals, and there's also been one on the market for a really long time globally, but it's not really tailored to this particular strain. And I think the level of protection is not so great. So Chris, let me turn over to you to talk a little bit more about, workers and vaccines and what this might mean from their perspective, not just kind of the structure of what it means to vaccinate.
Yeah, I think so. Even if we have a vaccine that's been through the various studies and trials, been proven to be safe, effective, you still have a huge barrier of trust. I mean, that's just that's one of the things that we've I say very unfortunately that we as public health practitioners are seeing a real need to be able to partner with community organizations, community-based organizations that can really be that key link in the chain to be able to implement an effective public health tool in our toolkit, be it vaccines or something else. And so I think that's no different here. I mean, I came up in the scientific ranks as a student, looking up to Dr. Gray's papers that were making statements in the leading infectious diseases journals saying swine workers need to be considered a key population for influenza vaccination, and all the reasons that was true in 2009 or 2008 when those series of papers when you were in Iowa came out, and it's true now for not just swine but livestock workers in general. And I think our experiences, and this is where I know some people are on our webinar now who have experience and work very closely with frontline livestock workers, and it's this, they are in a system where their job sustains their life, and it is any activity, any decision that they make that could jeopardize that job or that within that structure where, from the in-depth interviews we've done with these workers, they fear retaliation, they fear being skipped over in terms of the preference of shifts. They may or may not be under some of the protections that exist in terms of the documentation of workers if they are recent immigrants to the country. They are incredibly vulnerable. And often, if you think about that driver of their economic support and livelihood, the things that are that they're able to navigate that would not cause debilitating injury or illness or inability to go to work, they are pretty minor. In our experiences in discussions, in-depth interview discussions with livestock worker populations. And so I think anything that we can do, and I think it's what Dr. Gray said about anything that we can do to change the structure, to change the culture, so that not just trust can be built with the livestock workers, what we're trying to protect, the thousands and thousands of those frontline workers across the country, but it's also the producers, to make them be champions such that, all of the aspects of the system where workers would, under the classic, we are here at an education research NIOSH seminar. The healthy worker effect has been known for decades. We know that workers sustain and absorb hazards and risks and compartmentalize them in terms of, if it doesn't affect my ability to do the job and complete my work shift, I'm going to show up and work another day. So I think vaccines is a part of this challenge where we even would need to understand the priority of hazards within that the workers face on a daily basis, and where any protective intervention, be it masks, be it ventilation, be it interactions and contact with different food animals, or a vaccine fit. And I'd be really interested to hear Dr. Gray's view on this as well, but I see it as going back to not just the elements of how do we build trust with workers if we know something is effective? But also, how do we create change at a larger level, not just among the day-to-day production workers, but the producers, and then they're often in contracts with an industry. And so that's the sort of layer that I think that I heard Dr. Gray speaking about.
Well, let me jump in. I live in a pretty conservative state, and there's extreme reticence to receive SARS-CoV-2 vaccines. I can only imagine, the resistance to receive a experimental or avian influenza vaccine. So I think even if it's made available, you've got healthcare access issues and other things that will make vaccinating the workers challenging, and you're going to have to engage, healthcare provider networks. You're going to have to engage social scientists to win over the workers, etc. And so it's going to be tough. I see Dr. Kristen Coleman has her hand up.
Hi, Greg. My name is Kristen Coleman. I'm an assistant research professor at the University of Maryland. I was a postdoc under Greg Gray in Singapore for about 4.5 years before moving to Maryland. Just some background, but what I want to bring up is it's relevant to all the panelist speakers. Is I know that this talk is mostly focused on agriculture, but I think a very unique environment are animal shelters. So Greg, you mentioned that you had that video of cats dying on the farms and I think that I recently did a literature review of the past 20 years of literature on avian influenza virus infections in felines. So I mean, they are susceptible. It's been happening for 20 years, but we just don't know like how widespread it is. So I'm planning a study now to do some sampling in animal shelters, mostly a serological study of the animals. So mostly the cats. We probably will include dogs and the frontline staff that are exposed to the animals every day to see if there's potential risk there. My question to the panelists is, do you have any advice going into this? And are there any other locations aside from animal shelters that you might suggest we collect samples?
Yeah, I've been doing a ton of thinking about this actually, because I was in veterinary practice for about a decade before I came to this life of academic crime, shall we say. The work that's being done right now on cats has been somewhat sporadic. So you've probably heard about at least couple of cases of cats that might be indoor only. Unclear if maybe owner just didn't know that the cat got out and might have had contact with wild birds, or if there was another route. Yeah, exactly, in Colorado. Building on some prior studies in Europe, especially around the Poland outbreak, where there were a number of different risk factors for the cats, including raw meat, and in this case, also raw milk, which is not just something where, as a dairy vet, sure, I've been into plenty of barns and you see pails of, just pans of milk out for the cats that have shown up to volunteer for rodent control on the farm. And we're also seeing the potential, though our panelists yesterday and the day before noted that we really do need to do more work on the disease ecology in mouse species, but that mice a couple different kinds of mice on farms have been identified to be positive. Whether they become truly infected is work that is in process. So those are different routes of exposure, especially for house cats. Could be, the predator-prey behavior around mice, predator-prey behavior around birds, just contact with contaminated environments. And so, yeah, shelters could be a place where not only if it gets introduced, it could amplify, but then you also have some states, like Colorado has instituted testing of cats that come into the state lab for rabies, test negative for rabies. So these are neurologic cats that have died, testing them for avian influenza. So I think that that's one area that the states are looking at, and they have obviously the resource of needing to do sort of this mandatory rabies testing. The partners I would recommend from a veterinary perspective would actually be on the veterinary neurology side, right? When general practitioners in rural areas that might be seeing neurologic cases, so that you could actually even obtain swab specimens. The only challenge, and I'm sure Dr. Gray can speak to this, is that, you know, handling that biosafety level 3 when you're dealing with some of the novel avian influenza viruses. So you do need to make sure that the laboratory personnel are really well protected, and that you have the proper handling of specimens, as well as, you know, when you're doing the actual work of sampling, and then the work in the laboratory for confirmation. But those are just a couple other spaces I think people have been thinking about. Another small note, although I don't think this relates to study design, it's just happening, is the CDC One Health office has partnered with a veterinary insurance company, and this you would think would be exclusive to private practices, but they do work with shelters, and so they are working on trying to use what you might consider to be something akin, this isn't quite electronic health record work. You are still looking at, you know, an insurance company and what they're processing, but that's an interesting source of surveillance data. And I think figuring out where all these data streams are and how best to integrate them is something that all three of us have been thinking a lot about, and what that means in terms of protection of workers, as well as prevention of pandemics, early response and detection, and really trying to safeguard the public writ large and our communities. So let me see if either Chris or Greg have anything to add to that.
I was just going to add quickly, and I do see a hand up, so I'll try to be quick. But that was a really good point by the questioner there. But another area that I think is critical, particularly if we see evolution, reassortment to other susceptible food animal hosts, I think we have to think very carefully about different parts of the country and the world, similar to what Dr. Gray showed, where you not only have high herd stocking densities, for example, of swine, but you have got co-location of poultry as well. And rural Eastern North Carolina is a state where this has happened, where there's been pretty large scale expansion of industrial swine production, where the same producers can expand production of food animals by then, in addition to growing swine under contract, produce turkeys and broilers. So that's another space. It's not within the context of animals in other settings like you mentioned, but I think that's another key thing, as what Greg laid out. This is not something that's just going to go away, and if it's tough to control and it evolves and transitions into different livestock species, I think that's going to be a big concern.
See, Maria Pan has a hand up.
Yes, thank you for doing this. I will say that my head is spinning around with about 50 questions, and I wish I could have you for an hour here to ask all of them. I am from a community. We were exposed living near industrial farms, and I am working now with many community-based organizations, healthcare workers, workers within the industry. And there is so much to talk about. Firstly, a lot of the workers, about 50% here, are immigrant workers, and it is English as a second language. Why I'm saying this is because through talking to many, they are not even being trained in their native language. Okay, so if they're not being trained, we know that they're not getting instructions on how to protect themselves, and we've asked them about, certain issues. And to me, like, I think the transparency and cooperative working together really needs, I would argue, not only industry, but government needs to know this. Like, it needs to go all the way down into communities. As I see these operations getting bigger and bigger, and I have a friend that is an engineer that gets on the CDC meetings that they have continuously. And I believe, if I'm not mistaken, that many of the dairy were in close capacity to some poultry operations where Avian was. Am I correct in that?
Yes, and there was spillover.
Okay, so from being a community member, my thoughts are, okay, I know that the fans exchange air, right? What's coming in and what's blowing out. I know avian is spread by the air. The fact that these operations are getting very, very large. I'm on the Chesapeake Bay, the peninsula here, and poultry is the industry here on the entire peninsula. And we have seen in the past, I'm going to say since like probably the past 10 years, which used to be like 1 or 2 400-foot, barns that would hold 20,000 birds. We are up to 650-foot houses, maybe 12 of them that are holding 50,000 birds apiece, and they have no land surrounding it. They're called no land farms, which means you may have neighbors that are 100 foot from where those fans are. So, like, I just have all of, and the labor laws, I couldn't believe this, but the labor laws, with the industry saying that they are the biggest, employer in the region, there are 2 groups that are exempt from our labor code, and it is agriculture and domestic workers. And I think, like, we really need to look at this stuff because, quite frankly, it terrifies me that it's going to be, a pandemic that's going to get like COVID. And I mean, we've been for years talking about antibiotics and antibiotic resistance, and we're like, is there a way that we should be doing this that's safer? Because it seems like we're doing the same thing over and over again, and it's not getting better. That's all my questions.
Well, you had a bunch of comments and questions. Let me try to address a couple things. There's a whole new discipline, and Dr. Coleman, who asked the question, is a huge scholar in this, of bioaerosol sampling, and led by a number of people that have worked with the industrialized farming communities. And so there's a new way basically to measure viral particles in the air, and actually sometimes to capture live viruses, that is transforming our understanding of movement of respiratory viruses. And so there's a rich body of that and information, and it's very dynamic, it's changing. And there are all sorts of hypotheses how these viruses may have jumped from the dairy farms to the poultry, the egg farms, and we don't know. In fact, I've had veterinarians tell me that they are sure that their poultry farm was locked down. And maybe it's coming in through flying insects, maybe it's rodents, they don't know, or maybe through the air. But that's an area that there's a huge gap of knowledge in. And it will take scientists like Dr. Coleman at the University of Maryland to answer these questions with special sampling devices. Just like we're using wastewater sampling to look at the environment, there's aerosol sampling. The second thing I wanted to say is, the good news is we shouldn't panic, that there are naturally some species barriers from the movement, at least of influenza A, in domestic animals to humans. So I like this graphic that one of our young scholars drafted. And while we know that influenza A infects dogs, horses, cats, and poultry, there's real resistance when it's the viruses that are highly transmissible in those animals to move to humans. And so that's the good news. The bad news is there's less resistance, the least resistance, if this H5N1 virus should get into pigs. And then I think we might say in deep yogurt as a surrogate for fecal material. But the pigs have affinity to receive all sorts of viral types and to have them mix, and then because they're more like us than other domestic animals, for the virus to move to humans. And so in the sessions yesterday at the NIH workshop, we were saying we're really concerned that we do surveillance for these viruses in the pigs, and I don't know that that's being done either. So some comforting and some concerns thought we might share.
Now, we may just want to add that it's not currently a pandemic, right? What we have is a virus of concern, meaning that it has characteristics we do not like. It is definitely getting into people, even though, thank goodness, the symptoms we're seeing are pretty severe conjunctivitis and mild respiratory symptoms, but not people in the hospital and not people dying, which if you look at some of the other strains of highly pathogenic avian influenza globally, not this one, but others, you see sometimes very high mortality rates. So that's why we're worried, but we don't yet see that happening. What we don't want to do is keep giving this virus more and more opportunities, because it's already demonstrated an ability to infect lots of different mammalian species, and it has demonstrated the ability to infect people. And so that's the piece. And this is the reason I think that there's a tension between, hey, workers, we know you don't get that sick, but we really want you to protect yourself. We want you to take some vaccines to make sure you don't get seasonal flu, maybe even consider an avian influenza specific vaccine and wear lots of PPE, maybe have more barriers within your actual work functions to try to protect you from an engineering and administrative controls perspective against the virus. You know, we're asking for this extra burden, and that's because of this risk to the world, not just to people. But that's a difficult trade-off, right? And I think that we all recognize that, you know, what we're asking for is for sometimes additional burdens to be borne by those at highest risk. And that's something that, you know, ethically, we weigh these various, you know, pieces of the seesaw. I just kind of want to make one extra note, since I do represent a center for total worker health and mental health, where we think holistically. We really try to promote worker well-being, and we try to think about balancing a lot of outcomes so we have really good outcomes for workers, and that it's also beneficial for workplaces, and that we're really interested in mental health. Is that one of the things I was hearing in the last 2 days on the National Academies workshop that Dr. Gray and I participated in was the mental health strain at all aspects of this, that we have producers who are really fearful, and, you know, this is a lot of uncertainty for them, that workers have a lot of stress, not just necessarily, not even so much about their own health, I think, is about maybe the health of their families and also their livelihoods and sort of the economic viability of their place of work. And what that might mean, and that our healthcare providers are addressing a lot of additional burdens, and just responding to this places a lot of burdens on their work activities and their work functions. You know, Dr. Gray mentioned, you know, the veterinarians are kind of put in this sometimes difficult position of being the bearers of bad news, right? Or being the accredited veterinarian who has to report if there's a problem when maybe the dairy producer, you know, has a lot of uncertainty there. And so we've heard about, you know, veterinarians getting fired as you know, by their clients, and not, you know, being able to continue their employment. So I just want to say that the mental health toll of this, and, you know, from kind of a well-being perspective, is something that I think we may see more as we move forward. And I think that we really need to be cognizant that our immigrant and migrant workforces are the most vulnerable within this context and may lack access to a lot of the services to help navigate some of these stressors. These are really tough things to address. And I think that that's something where we need to be putting a lot more attention.
Yeah, one other thing I would just like to add, and thank you for all, this is really, really helpful. A lot of the workers, a lot of the processing plant, at least workers here, use temp agencies. So this came up with COVID because you had, people who were getting sick or who had feet, but when they, had to take off work, they are not covered by health insurance the way that, so like, I think, yeah, there's so much more that we could do to do this better in relationship to, yeah, I absolutely agree with that. Even the growers, because the growers are scared, yeah, it's important. Thank you.
Well, let me jump in and say one more thing, Maria. There are organizations like that at Hopkins. I think of Annabelle Rodriguez at Texas A&M, who's a huge advocate for the workers in Texas. We're working on translating educational materials in multiple languages, just because, as you say, it's not just Spanish speaking, but other Latin speaking immigrants that are at these facilities. So there's a movement afoot to get educational materials out there, and there's a lot of catch up being done. And so I think if you explore with Annabelle Rodriguez, she's an assistant professor at Texas A&M. She could point you in some directions, perhaps where you could get some effective literature for the people you support.
Yes, thank you. We have some committed people. I will say that Dr. Spicer had translated some into Creole that we could pass along to the workers. So we appreciated that. Yeah, thank you.
I see there's a Dr. Bruce Libby on.
Hi. I appreciate this presentation. I just wanted to raise an issue. I worked on a grant from the Department of Homeland Security and APHIS from the Department of Agriculture, where we really train first responders and these commercial farms about taking down a flock in a commercial, chicken house. They were back. This is 2007. They had a device that sprayed out foam that just was dragged down through the chicken house, covered all the chickens, and they could kill them all in a matter of minutes if there was an outbreak. But and then they had procedures for composing the bodies, and we worked with respiratory protection and Tyvek. But my question is, free range flocks were the wild card. They looked like they could control the commercial flocks, but are you folks looking at that at all?
Yeah, that's a really good point. Both that and just turning off the mechanical ventilation are both depop strategies that are used that tend to, I think, not expose the workers quite as much. My understanding is that some of the exposures have been where workers have been needed to catch the birds, and I am not sure if the Colorado poultry facilities were that, or if because I think these were layers. So it's not where you can just spray the foam, right? You've got these cages stacked, like high.
Yeah, that's not going to work. You're right.
It's not, foam's not going to work, and whether mechanical ventilation would be suitable or not. I think that they were using CO2 boxes in that, and it was 104-degree heat, and they had major industrial fans, and so some of the industrial hygienists who, because there was one deployed by the CDC. At the request of the state, is my understanding. They were worried that it was affecting the seal. So if any of you have been fit testing, right, for those who do OC Health, right, you need to have good seal on the N95 mask or whatever other respirator you're wearing to make sure that nothing kind of creeps in underneath. And so I think there was some observation of a little bit of flutter there because of the air movement, the mechanical ventilation. So making PPE, like some of us have been talking about, we need a design challenge to get engineers who are thinking about material science and innovation to redesign PPE, thinking about climate change and thinking about our agricultural workforce who already are impacted a lot by heat stress. And the other piece is, I mean, come on, I've worn Tyvek, and Dr. Heaney and I were doing Staphylococcus aureus sampling on pig facilities on a fairly toasty day. It was not 104. It was definitely less than that. And I think I lost half my body weight in sweat after the first hour. You can get dehydrated, and that's, of course, life-threatening too. So thinking administratively about how you have to balance worker needs, because you certainly don't want to be drinking while handling infected birds, but you're going to need to think about hydration status. So yeah, back to you, Dr. Lippy. I think this is an incredibly important point.
Thank you. And this has been a terrific presentation. Please appreciate it.
Here in this last 5 or 6 minutes, I did want to ask our panelists, because I love deliverables. That's something I love to be able to come up with, is to give something. And I wanted to ask our panelists if you could just each of you give me one thing. If I'm the nurse director or the nurse manager, or I'm the health and safety director of my plant, or I'm the crew chief of my construction crew that works in agriculture, or I'm a grower, a producer, and I want to do something to support the health and well-being of my crew or my staff, either physically or emotionally, mentally. What's one solid step that I could ask from each of you that I could do to produce that effect around this topic?
Greg, Dr. Gray or Davis, you want to go first?
I can go ahead. So I think the first thing that an employer, supervisor, manager needs to do is ask workers what they need, and then ask them how they think things should be changed, because they're the ones doing the work. And so if you really want engagement, having activities that can help to empower them. Now, it may be that there needs to be some education around this, because if people just don't understand any of the mechanics of H5N1, they may need to be primed in order to understand what potential risks there might be. But if the challenge is, for example, you go into a dairy milking parlor and people aren't wearing PPE, then the question is, do you understand what the risks are? Is it just a risk trade-off, right? Oh, I've heard people are getting sick, but not that sick, right? Then that's a different conversation around what they might need than, I didn't even know there was a problem. I'd like to protect myself. And then the answer might be that you're going to help provide people with goggles because they get splashed all the time. And that's going to be their riskiest route of exposure. It's something they may or may not have access to. And it's one of the things that we really strongly recommend within this workforce. Even if you can't put on the full Tyvek, to at least try to do some masking, covering of the mouth to protect against splash, and then absolutely covering of the eyes, since conjunctivitis is a big route of exposure. So asking them what they think and what they think is feasible and what their ideas are will really help to empower and engage.
Engaging your colleagues and employee status on just the issue itself, starting there.
Absolutely.
Great.
Yep.
Great, thank you.
Let me try to jump in. So I've had some contact now with a dozen or more bovine cow farms in multiple states. And probably we are very biased in this farms we see, because the farms I talk to, the farm managers, the farm owners, really care about this. They want to protect not only the animals, which is their income, their milk products, and if they're beef, their beef products, but they also want to keep their workers healthy. And so, to get back to your question, I think if I were an owner, I would look for educational materials that would help communicate the risk to the workers. I would look at doable interventions to keep my farm safe from transmission to the workers. It can't be terribly expensive. And I would look at what's possible with respect to PPE, personal protective equipment. and just try, they educate their workers all the time about things because it's a food security product. And so this would just be one other thing on the training list. I think the best farms are already doing that. It's the farms that are sort of hiding, that don't want to wave the flag that we're infected, that don't want to be studied. Those are the ones that probably we're more concerned about, particularly if they're huge, and these viruses can just replicate, churn, and develop new variants.
Yeah, and I think
Education. Thank you.
yeah, building off of that education, it's also to get at that diversity of different producers and farms. I think we see the same thing in our interviews with swine, industrial swine operation workers. And some of the things that would be helpful is that, similar to what Dr. Grace said about, a lot of the producers want to protect their animals, want to protect their workers. It's also figuring out a way to engage, build a supportive structure, not just around, say, education around PPE, or as Megan's saying, do you know what this is? Do you know what the risks are? But if we get past that and there's an understanding and a recognition and there's okay, so what can we do? It does get into PPE, but also gets into safe, private, confidential testing or knowledge about, because not every farm is at risk, right? So you could avoid a lot of, PPE, there was a shortage that still costs money to implement PPE out. There's other reasons to do it, not just for avian flu, but I think one of the things is just getting, cracking the problems around access to testing. Perhaps bulk milk's a way to do that, but also workers who want to know, is this going to affect me and my family? In a way that protects them from potential job loss or losing a shift or losing a job. But also, if there is a positive, there can be a way to interface and bring supportive structures, which requires these agencies from the local, state, and federal response to be able to engage. And so that's a complicated thing, I think, that all of us have been, Dr. Gray and Dr. Davis have been talking about, is how do you create the conditions and the climate so that you can do all these things that from a prevention standpoint cannot have unintended consequences.
Yeah, the threat to the businesses was so great. The way we were able to receive or to collect 1,000 specimens is by saying that we were protected entity of the farms. We wouldn't release those. And then they were willing to either send us specimens or let us collect specimens. So Chris's comment is very valid. Protecting the farms, protecting the workers from any sort of negative consequences of being engaged with this epidemic is huge.
So I hear starting the conversation, promoting education, and promoting security in the conversation, that the conversation can take place without retribution and job security. And I really appreciate that. I think those are very feasible, doable next steps. And with respect to everyone's time, it's 5:32. I just want to take a second and thank all of our panelists for taking the time and the effort to put this together with us. Really appreciate this. I'm not really going to clap for a round of applause here. In the chat, there's been some resources shared by several folks. Let me see. Kristen had some materials for avian flu for the general public. Thank you very much. My email is in there. If there's anything that you wanted to say and you didn't, I'll put it in there again and try to relay that to our panelists. There's my email. And yeah, thank you again. Be safe.